Hi, good evening. Steve Adler. Got a minute. All right, so this is Tuesday. We're going to go over the dashboard so we can see the main numbers. But then we also have today is the Tuesday Data Dump Tuesday. So we have a lot of charts and graphs for people that like to see those. Maybe compare them if you want to with what you saw a week ago and the week before that. But let's begin though. Talking about the virus numbers. Let's focus first on the one we always start with, which is the number, the 7-day moving average for admissions. The number is 35. Same number it was yesterday. Remember, 7 days ago, the number that dropped off was 45. That 45 dropped off. It's replaced with 42, which is the number of new admissions today, because the number dropping off is about the same as the number that we're adding. In the 7-day moving average, the number really doesn't change at 35. But it is a concern that today's number is 42. Yesterday's number was 43. If we continue to get numbers that are in the 40s, then that 35 number will start creeping up. Remember, we get into the red range if we start crossing over into 50. This is the period of time when we would expect to see hospitalizations associated with people that over the Thanksgiving holiday were around larger groups of people, maybe family, maybe friends, but larger groups of people, especially not wearing masks. And our hope is that we can stay in this range of 35 and be stabilized there. The hope is that if we rise, we don't go above the kind of the low 40s. We're trying to stay away from 50 and the red zone. Number of new cases today, 355. That's a concern because it's almost 20% higher than the 7-day moving average, which is 297. 355. So we've had several days running here where we're in the mid 300s. Same kind of relationship we're seeing with new admissions. First place we see it is in new cases. The more new cases you have, the more ultimately hospitalizations you have. So we're going to continue to watch the new cases, but sometimes that can be related to the number of tests you give. So really the most independent number, admissions, that's why we focus there. You can see the chart in the middle kind of flatten out as we approached into that orange area, but you can see the numbers are beginning to trend up here lately. So we'll continue to watch that. The green numbers are the 7-day moving averages for hospitalizations for ICUs, which is where we will face the first signs of being overwhelmed should that happen, and ventilators. Those are the 7-day moving averages. Let's see where we are tonight. With respect to those three things as we check the indicators. 7-day moving average, hospitalizations, 229. But tonight in our hospitals, as you can see, we have 257 people. So like admissions, like cases, tracking up above the 7-day moving average. How many people do we have in the ICUs tonight? It's 82. The 7-day moving average is 77. So again, higher than that number. People on ventilators the same way. 52 people on ventilators here tonight. The 7-day moving average on that last dashboard was 45. So all three of those numbers are tracking higher than the 7-day moving average, which means that generally speaking, our numbers are tracking up, which is kind of what we expected coming out of Thanksgiving, the holiday itself. But let's hope that the numbers kind of tail off. It's hard looking at the number of new cases with that 4 in front of it, having crossed into 40,000. But with the additional 355 cases, we're up to 40,836. Number of people passed away, 496. That's one more than yesterday, which means that, again, there's a family in Austin that lost a loved one. This illness is real. And we have to be doing everything we can to try to manage it. At the same time that we're continuing to try to survive in the city. Good news with respect to vaccines. We went over a little bit of that yesterday. It is coming. I saw today they started actually issuing the vaccine in the United Kingdom. Some people actually got the viruses. 90-year-old woman was the first one to get the vaccine. Indications are really safe. Indications are that the very first shot, you have to take two. You have to take the booster, but even the first shot helps. You can get, some soreness from the vaccine, but it passes quickly, and the results seem to be good. I anticipate that we're going to ask our scientists and health people here locally to do their own review of the science and the data so that they can advise the community on whether it's safe and the smart thing to do. But all indications kind of point that way. In December, we should be getting the vaccine, but initially it's just going to go not open to everybody, just go straight to the hospitals to get to our frontline healthcare workers that are putting their lives most at risk. Then probably getting to the folks in the nursing homes, because those people, when they get sick, usually or generally face the most severe consequences and death. Really high percentage of the number of people that have died in our city, over 200 of the almost 500 people have been people in nursing homes. All right, let's take a look at the broader data so that you can get a kind of a bigger picture of where we are. The first is new confirmed cases. The yellow line is the 7-day moving average. The blue line is the number of new cases. This went through a day or two ago, because that's when this chart is prepared. But you can see that yellow line, new cases. It's trending upwards, kind of stable over the last 14 days. But we went down. We're coming back up now. Staying lower than where we were in the summer, which is that peak in the middle. Let's hope that we can continue to sustain that. All right, let's go on to the next one. This is admissions. This is our key number. You can see that line is a little bit quieter. Blue is the actual number. The yellow line is the 7-day moving average. You can see that it too kind of stable over a week to 10-day period of time. But here, recently, the number is moving up, which is the kind of the concern we're looking at. Let's look at the next chart that we want to see. This one has the admissions, the hospitalizations, that hospital admittances. That's the blue line at the top. That we've already gone over that. You can see the orange line, which is the ICU admissions, and the kind of gray line under that, which is ventilators. Remember, the first thing that we see when people get infected is an increase in the number of cases. Usually that happens within 3 days, maybe 5 days of somebody getting infected, up to 10 to 14 days. And then the people that get sick, the ones that end up in the hospital usually about a week after that. And those folks that end up on ventilators could happen several days after that. They go to the ICU, and then several days later, and then to the ventilators. So these factors are lagging indicators. They all follow one after another, but they are to a degree predictive of what you're ultimately going to see as a general rule. So we don't see the real increases yet on ICU admissions and ventilators, but we're going to continue to watch those. Number of people in our ICUs, which is our stress point right now, just over 80. We have about 200. But we need to make sure, if it looks like we could be in a position where we're approaching 200, we're going to sound the alarms for everybody to really change behaviors. But right now there's capacity in our ICUs. Hospitals still doing elective surgeries. If you have something that needs to happen, still now is a good time to go and get it done. Don't put off work that or something, a procedure that needs to be happening. Let's go to the next slide. The next slide shows us cases by county per 100,000 population. So this has been adjusted for population. The number at the top there is El Paso. That's the city we were talking about, new cases being kind of scary. You can look at that increase that they were having just a week or two ago. Almost a vertical line, how quickly they went from 1,000 cases per 100,000 population to almost 5,000 cases. It didn't take very long because of the extreme nature of that. We also saw the line that was going up in Lubbock, but it seems to be the blue line below that, but it seems to be leveling off at this point. Below that, the green line and the orange line, that is Dallas and Tarrant County. You can see that's significantly higher than where we are. In the cases per 100,000, just by way of letting you know, the line all the way down at the bottom, the dark blue line that looks fairly flat compares to the others, is Travis County. So you can see, it's just a couple hundred per 100,000 people in our city. But you can see Tarrant County and Dallas County, the green and the orange line are about 800. So they're about 4 times as many cases per 100,000 than we are. The next 2 lines, that's Harris County in the yellow line, which you can see was higher, came down, and now is kind of flat. Have just recently passed by San Antonio, Bexar County, which is that blue line. That number in Bexar County is of real concern, seems to be moving up pretty rapidly. So while they're really low at this point, they're looking at something of real great concern down there. And then the line down at the very bottom is Travis County. 2 thoughts on that. The first is we should all be really proud of what we've been able to do as a community. You know why that number is that low? It's because people in this community are wearing masks. It's because they're wearing masks when they're not around people that are in their home, in their household. It's because generally we're social distancing. That does not mean everybody, but it means that our adoption rate is higher than other cities. I wish cities across the country were masking the way we were masking. We wouldn't be looking at the kind of trends we're seeing in other places. In Texas, we wouldn't be seeing what we're seeing around the country. The more and more data that comes in, the more and more it becomes inescapable that the single most important thing we can do is when you leave your home, put on your mask and wear your mask around other people that are not in your home. Social distance. But anyhow, that's that chart. Let's go to the next chart. This is a chart that talks to us about deaths by county. And you see a similar kind of relationship here that we saw before. The very top is El Paso. Below that, the light blue line is Lubbock. The dark blue, the medium blue line is Bexar County with almost 80 deaths per 100,000 people. Remember, their number was low in terms of total number of cases, high in terms of deaths. As you can see, the yellow and line is Harris County. The orange line is Dallas. Those are similar kinds of lines. The green line is Tarrant County. And then the dark blue line down at the bottom in deaths per 100,000 people is us here in Travis County. If you want to know what happens when you can keep this virus under control in terms of deaths in your community, and what we could have faced had our community not been as vigilant as it has been, just compare Austin to El Paso. In Austin, we've had less than 40 deaths per 100,000 people. If we were looking at the same kind of situation that they have in El Paso, we would have 4 times as number deaths per 100,000 people, 4 times as many. We have about 500 people that have died. If we were looking at the same kind of situation here as they had in El Paso, it would be 4 times our 500, about 2,000 people. 2,000 people passing away in our community. Fortunately, we're at 500. But as a community, with the vigilance and the work we're doing, we've saved 1,500 lives. And we should be proud of that. That's the first thing. We should be proud. Second thing is we need to know how quickly things can change. And we saw that on the graph earlier about El Paso. This number can get out of hand really, really quickly if we lose the discipline and the vigilance about masking, social distancing when we're around other people. We don't have a vaccine yet. It's good. It's coming out. It's going to protect the people we can get it to so that they can actually do greater work in our service. But it's going to be spring into the summer before everybody gets a chance, which means we're still going to be doing these behaviors, still wearing masks, still protecting our neighbors and everybody around us. So kind of, settle in and know that it's something that we just have to do. Let's go to the next chart that we have. This shows you hospitalizations by race and ethnicity. The green line at the top, the Latino community, numbers were high and represented a number that was significantly higher than the percentage of that community in our population. You can see that the number, the green line now is below the blue line. The blue line is the white population in the city. The green line getting down to the place where it is just over 40%, getting closer to the number that the Latino community represents in the city. Actually, it's just about 30, so it's about what the population is. Blue line is up above. The white line is the African American population at about 10%, just a little bit higher than its percentage in our community. Let's take a look at the next graph. This shows you positivity in the community generally. Remember, positivity, we want to get below 3% if we can. We were under 5% there for the longest period of time. You can see 3.8, 3.6, 3.3, 3.9, that's where we were. And then our numbers started going up to 6.8 3 weeks ago. It dropped down to 5.2 and is now back up to 6.8%. That's a lot better than looking at a 10% number, a 15% number, a 20% number. And some of our subpopulations are looking at those numbers. We'll talk about that in just a second. But that number is the number we're trying to push down. The lower we can push down that number, the better chance we can keep schools open and the like. Why is it that we were at 5.2 3 weeks ago? How could we be at 6.8, 6.5, 6.8, but in the middle there we dropped to 5.2? That's because positivity is a measure of how many people who take the test are actually infected. That was the week before Thanksgiving. People who were intending to travel or be about during Thanksgiving, we had a lot of people go get tested to see where they were. So the testing numbers were really high that week, which meant that we were finding a lot of people who did not have the virus, which is why the positivity rate was lower at 5.2. Let's go to the next chart that we can take a look at. This is now by week. We have 4 weeks in there, 4 clumpings of color. This is looking at populations week over week. You can see that the numbers last week to this have remained pretty stable. The gray line that is over 10% is the Latino community in our city. Stable over the last couple of weeks, but still higher than we need it to be. We need to drop down to below that red line. We actually need to, which is 5%. We actually need to drop down below that green line, which is 3%. And we were so close to the 3% back when we were in the yellow zone. The yellow zone, risk stage 3, we're not there now. We just have to be really vigilant as we're in this holiday season. Let's take a look at the next number. Vigilant means masking, social distancing, not being in large groups. The single most important things that we can be doing. This is looking at age groups, positivity, same way we looked before. What numbers have gone up? It's the orange line and the kind of mustard line. The mustard line are people 10 to 19, and the orange line are people 40 to 49. It looks like most of those people in the 40 to 49 and the 10 to 19 area are people that are socializing with larger groups, socializing, not with people in their household, socializing, not wearing masks. Just wanted you to see those numbers and hear what's driving the increase in those numbers. We need to wear masks. Next chart. This is a chart that talks about how long to quarantine. The general rule was 14 days. This is on the website. You can find this page. It's hard to read where you are. But CDC came out and said now that depending on your situation, if you have a close contact, it may be that you don't have to quarantine or isolate for 14 days. Let's talk about this for just a second. Close contact. What is that? Close contact is that if you're around somebody who has the virus for within 6 feet for an extended period of time, which means over 15, 20 minutes. You're around somebody has the virus for 15 or 20 minutes within 6 feet. And this tells you then how long to quarantine, because there are some situations where you don't need to quarantine as long. But here's the chart. If you have a close contact, that's the top, you follow the line down, which is that black line in yellow. And the first question that gets asked is, when you were in close contact with that person within 6 feet for 15 or 20 minutes, were masks being worn? If masks were not being worn, then it's 14 days. It's as simple as that. You don't even get to consider all the other options to get under 14 days. If you were in that situation and you weren't wearing a mask, then the CDC still calls for you to quarantine for 14 days. However, if you had that close contact with someone, later they turned out they had the virus, but you were wearing a mask, the chances that you were infected go down substantially. So you can quarantine for a fewer number of days if you're not in a high-risk setting, if you're not going to nursing homes, if you're not elderly, then if you're not going to be around elderly people. If you are, then you have to quarantine for 14 days. If you're not, then you can quarantine for 10 days and take a test and then stop. But that's what it takes to look at is what is the high risk situations that you're in. If you're a healthcare worker or a first responder, then 10 days and you need to go ahead and get a test. But anyhow, I point that out just because the threshold question is, were you wearing a mask? Again, to impress upon you just how important that really is. Let's go to the next chart. This next chart is one that talks to us about the flu. And again, I'm really proud of the community on this one. Remember last year, our intensive care units got filled with people that were just suffering from the winter flu. We said we couldn't have that happen this year. We need to keep those beds open for people that have COVID. And the extra beds need to be there and available for somebody who has a heart attack or is in a car accident or the like. So we need to keep the flu numbers really low this year so that people with the flu aren't ending up in our hospitals. Look at this chart. The color lines at the top is flu cases over the last 3 years. Last year, the year before that. The blue line down at the bottom that we look at every week is the incidence of flu this year. And I will tell you that the reason that that number is low is probably because we're wearing masks. And everything we're doing to stop the spread of COVID is also stopping the spread of the flu. But it just tells you, look at the difference in just flu spread the last 3 years, given the steps that we're taking in our community. Let's see if we can keep that blue line down that low and just keep it there below 2% as we continue to do our work. What's the next chart? That's just the color risk chart. We're down now in the orange area. We moved there about a week before Thanksgiving. That's stage 4. We go above 30. We're in that orange zone. If we go above 50, then we risk Dr. Escott telling us we need to go into the red area. Let's see if we can avoid that. Best chance to keep schools open, like we say, and keep businesses open. Hey, yesterday I shared a way to help take care of one another in the community, talking about businesses, a few ways to really support local and small businesses this year. They're hurting. So you should put them on your Christmas or holiday list and try to give them some business. Call up your favorite businesses and order a gift card that you give to somebody or that you'll use sometime soon or even a year from now. Let's see if we can support businesses. But here's the link to the Austin Asian Chamber of Commerce. We did the General Chamber of Commerce yesterday. You can go there and find a listing of some small local businesses, gift cards, curbside, shop inside with a mask and reduce capacity. Don't be in and close to people. Make sure you can social distance. Eat outside at restaurants. Order takeout. These are the things that I continue to do. Those things are safe to do. And it's important that we continue to do those things to support our local businesses. But I'm going to conclude with, if you leave your home and you're going to be around other people, wear a mask. Wear a mask. And that is the single most important thing you can do. Social distance. Mask. Most important thing. Add to that social distance. Add to that no big groups. Stick as best you can to your family household, recognizing that that's not an absolute rule because there's still business activity and shopping and other things going on. But as a general rule, when you can, try to limit the physical interactions. With that, this is Tuesday, Data Dump Day. I hope you got a lot of what you like to see. With that, good night. Y'all take care and be safe.